Good morning, guys. Tony Maritato here. I want to read a post that came in on the Total Knee Replacement Support Group for Kind People from Facebook. I think it's a great perspective, and I think it'll help other people hear your thoughts. So the post says, quote, "I'm 62, not physically fit because of my obsessive crochet habit and lack of motivation, aka I'm generally lazy." First of all, I'm sure that's not true, but I'll continue reading. So I've been horrible about doing prehab. I'm scheduled for a left total knee replacement on June 3rd. Today is May 13th, just for perspective. I'm afraid that I'll fail the post-surgical PT, wondering if I should postpone the surgery, but afraid even that won't motivate me to do the prehab. I'm in a quandary and hoping for words of wisdom from wiser people than me. Thanks in advance. So this member is dealing with the same challenges that hundreds or thousands of other people are dealing with. The reality is there are lots of things you probably would do in a typical day that still qualify as, quote, prehab. Just getting out, walking through nature, doing things in the garden, doing things around the house. I do understand crochet is a relatively sedentary hobby, but I bet you are still doing things that you don't even give yourself credit for. And the reality is, I have seen hundreds, if not thousands, of patients over the last 20-ish years of being a physical therapist. I can tell you that I've seen patients that were very sedentary, either because of work, because of other restrictions, other limitations. I don't see a strong correlation between being sedentary before surgery and having a positive outcome. I've truthfully seen people that were incredibly physically active have the surgery and have a very challenging recovery. I've also seen people be relatively sedentary, have the surgery, and do amazing after surgery. The factors that influence somebody's outcome after surgery are not the same as the factors that contribute to your fitness level or doing your prehab. Now, of course, everybody should be doing some level of prehab. And if you haven't seen a physical therapist yet, this would be a great opportunity. The physical therapist's role before surgery isn't just to make you do the exercise. It's also to help understand, give you information, educate you, answer your questions. But I think my role, at least, when I treat a patient before a knee replacement, is to help them prepare themselves for the best possible outcome. And that doesn't usually mean getting them to do a whole bunch of exercise. There might be one or two things that I recommend that they do, but it's really about the mindset. It's about preparing for the recovery. It's about understanding the challenges that they're going to face between sleep, nausea, nutrition, dehydration, all of these other factors. Because if we can account for that stuff, you're going to have a much better experience. And usually your outcome is going to be very positive. So I would tell you, don't stress out about not doing prehab exercise. But if you can, go schedule a physical therapy evaluation, find somebody that you like, that you trust, that you relate to, have at least one session, maybe 2 or 3, and then you'll be in a much better place for the recovery to happen. Thanks for posting. Guys, anyone who has questions, you're welcome to join. It's a free Facebook group, the Total Knee Replacement Support Group for Kind People. Come check it out. It's an amazing community, and I wish you the best.